Hello, my name is Sukhpreet Kaur. I'm a student of Purdy Global Family Nurse Practitioner course. So today I'm going to present the case of Miss Clary Henderson. She is 37-year-old female. She came to the office with the complaint of not able to conceive. She been trying from last 11 months with unprotected intercourse. She presented with complaints of irregular periods, heavy menstrual periods, and she noticed some changes from couple days, like she have some pimples on the face, some hair growth on the chin area, and so she was not sure what's going on with her. So I asked her about the history, about the family history, about any current medication. She's not on any medications. She is allergic to sulfa drugs. So, and she doesn't have any history of any medical disease like thyroid, diabetes, COPD, asthma. So no other medical history. So for the family history, her mother was diabetic positive. So her mother was a diabetic mellitus, and her father is healthy. He doesn't have any disorder. So both of the parents are alive. So she's a school teacher, and she denies for any use of tobacco, alcohol, or any drug use. So I assessed her from head to toe. She recently gained weight. Her BMI is 28.1, which is high for her as per her height, because her height is 5'1". So, and her weight is 170 pounds. So it shows she is overweight. That could be the reason that she's not able to conceive. So we'll order some diagnostic test. First, I will assess her from head to toe. I assessed her from head to toe. So she denied for any fevers. There's no change in her cardiovascular. Her lung sounds are clear. Her respiratory sounds are clear. There's no crackles, no abnormal breath sounds. Her ears and eyes are normal. She doesn't complain any abdominal pain, constipation, but for her gynecological examination, she complains heavy bleeding and irregular menstrual cycle, but her last menstrual cycle was 3 weeks ago. No history of any STIs, and she denied for any pap smear test also. So she denied for any muscle stiffness. There's no changes in her breast. She suffered from mild stress and depression. So I ordered some diagnostic tests to rule out the reason how to diagnose. So I ordered CBC, CMP, lipid panel, thyroid panel, HCG, and some hormonal tests like prolactin levels, luteinizing hormone, and sex hormone binding globin. So the results came back. Her A1C is 7.2, which is elevated. So she is diabetic. She is insulin resistance. And her testosterone levels are also 141. And her pelvic ultrasound also shows like she has a bilateral ovarian cyst. So all these things indicates hormonal imbalance, and which makes her irregular menstrual cycles and not able to, maybe the ovaries are not secreting the follicles and not ovulating on time, and that's why she's having trouble in getting pregnant. So I diagnosed her with polycystic ovarian syndrome. So in this syndrome, people have like low-grade inflammation. They have hyperandrogenesis, insulin resistance, and hormonal imbalance. Also, these PCOS also leads to diabetic mellitus also, and our endometrial cancer. So we need to fix this problem. So I'm gonna prescribe some medications. The first is we need to balance the blood sugar, because insulin resistance is the major problem for all these symptoms. So first I'm going to prescribe her metformin 500 mg 2 times a day for 6 months. to improve the insulin resistance, to lower the androgen levels, and also to improve on her ovulation. Second, I'm going to prescribe her letrozole 2.5 once a day for on cycle days like 3 to 7. So we'll increase the dose if there's no ovulation occurred. So we'll keep monitoring, keep doing the ultrasounds to check the follicular follicles. So I will give some patient education for the non-pharmacological management like weight management, repeating the A1C and regular ultrasounds, and I will explain the reasons like why a healthy diet, Mediterranean diet is important. And I will also encourage her to do health promotion examinations like breast self-examination, pap smear, vaccination against influenza, and I will recommend her to follow up in 3 weeks.